And I have another question regarding these quick lift facelifts. So
Okay.
what is your thoughts or, you know, um, concerns or anything about those versus a traditional facelift?
Yeah. As would be expected and as would be understandable, everybody is looking for a more efficient way to do things, a quicker way to do things, a less expensive way, and a way in which they can utilize the physical talents of somebody else to do the actual work for them. Now, a quick lift is not something that I would expect a technician or nurse to do. That is something that a
Mm-hmm.
surgeon would do, or a dermatologist, or some medical person. And basically, there's a variety of procedures that I personally lump into that designation as quick lift or suspension lifts or string lifts or barb suture lifts, things like that. The quick lift actually would be, as I understand it, is what we at one point would refer to as a mini facelift, where an incision is made in front of the ear, it's carried around the earlobe and back into the hairline, and the skin is elevated for a variable distance
Mm-hmm.
towards the corner of the mouth and the cheek area, and then the skin is just pulled, tighter, and a little portion of skin is removed in front of the ear. Now, when you compare that, and that doesn't take very long.
Mm-hmm.
And initially, they look pretty good because there's swelling and there's a little tightening. But as the skin relaxes and stretches back down again, and the contents beneath the surface of the skin become more visible all over again, you don't really see enough of an improvement most of the time for
Uh-huh.
me to ever feel like that's adequate. That certainly cannot be compared to a surgical procedure where the skin is elevated, and then as a second layer, we drop down to a deeper layer called the SMAS,
Mm-hmm.
which is a muscle layer, and we elevate that SMAS and we pull and tighten that SMAS a little bit and reposition, the muscular elements of the face. And then we redrape the skin over this pulled and tightened deeper layer, and we remove skin from that face as well, the skin of the face as well. So those kinds of maneuvers take a lot more time. They take a lot more of an effort. We are combining that with sculpting the SMAS by suture plication of the mound and we're adding fat grafts to the face, not to the lips, but to the other areas of the face that are not so dynamic, that don't move as much. And these kinds of maneuvers that we're doing now are entirely more sophisticated than a simple excision of skin or some type of a suspension suture type of a technique where you're passing a thread lift they call it,
Mm-hmm.
into the cheek and curving around and pulling it back and tying it. That kind of stuff. I've never seen to be as efficacious as the more invasive facelifts that we're doing.
Now,
Even laser resurfacing will tighten the skin a little bit, but nothing like what a facelift can accomplish.